Situations haunt our sleep.
Also at the State House, medical professionals told lawmakers about the challenges impacting women's health care in Idaho. After the U.S. Supreme Court overturned Roe v. Wade in 2022, Idaho's abortion trigger law went into effect, outlawing almost all abortions in the state. Doctors can perform an abortion to, quote, prevent the death of the pregnant woman. But doctors say they don't know how close to death their patient has to be. One of the organizers of today's informational session in the Lincoln Auditorium says they want to share what's happening in women's health care and the impact this abortion ban is having on the provider workforce. They also want clarification on Idaho's law.
And as physicians, we're trained to intervene when we recognize sickness, not to watch an illness move along that line until death approaches. Waiting is bad medicine and can be malpractice. There are so many examples in medicine where timely intervention is critical to having a good outcome. Most people know that receiving timely intervention for a stroke or a heart attack is critical. Similarly, timely treatment for a pregnancy emergency is also critical. And this is the problem with Idaho's abortion law. We only have an exception to prevent death of the mother and not to preserve her health.
Dr. Sarah Thompson says because of this conflict doctors face, some of her colleagues have left the state and more are considering leaving. Women are also having trouble getting in to see OBGYNs. Idaho Hospital Association CEO Brian Whitlock says there was a doubling, even a tripling, in OBGYN vacancies in Idaho hospitals from June 2022 to June 23.
Our member hospitals are telling us that it's not only the competition that has created vacancies, but also a lack of interest in filling those vacancies. Hospital administrators are telling us that the lack of clarity in Idaho's legal environment regarding maternal health care has created uncertainty and fear, and candidates are now looking elsewhere.
Whitlock says some Idaho women are affected by what's called an obstetrical desert, where they have to travel dozens of miles to receive health care during their pregnancy. We're back after this.